As a culture, we don't talk about birth. Many women get pregnant and they look down at their belly and they realize, wait a second, I don't know what contractions feel like. I don't know what the labor process is going to be. And sometimes I will have partners look at me, eyes wide, Mary, what's happening? I'm like, no, this is a good sign. You want to really invite people into your space who are going to fill your cup up.
Meet Mary, a certified birth doula, educator, and founder of Philomena Birth, a doula agency in Red Bank, New Jersey. She's supported over 300 births and brings a calm, compassionate presence to every step of the journey. In today's episode, we talk about the power of doula support, the importance of birth education, and all you need to know about how to maximize the pre- and postpartum experience.
Because they get super confident. And now when women are, at home laboring before I join them, I have dads texting me and they're like, her contraction pattern's still at a 711. She's curb walking, a little bit of show, this, that, and just using all the vocab and really confident in what's happening. And that just makes me so happy.
Well, thank you so much for coming on the podcast today. We're so excited to have a doula here. Can you just tell us who you are and what you do as your work as a doula?
Great. Yeah, I'm very excited to be here as well. So my name is Mary Sefcek. I am the owner of Philomena Birth, and we are a doula agency and childbirth education center in Monmouth County, New Jersey, based out of Red Bank. I personally am a DONA certified birth doula. I started doing this work 6 years ago. I've seen about 300 babies born, which is kind of incredible, truly an honor every time. A big part of what I do too is childbirth education. So I'm a Lamaze childbirth educator and a lactation counselor. So I'm really passionate kind of about this, what I call like our secret sauce of this combination of really good childbirth education in pregnancy, as well as pregnancy support, impeccable labor support day of, and then carrying that through into the postpartum period as well.
So how are you finding that giving that education is helping women when they're in labor?
I think it changes everything, and I cannot overemphasize the impact of being informed before you walk into the labor room. As a culture, we don't talk about birth. Many women get pregnant and they look down at their belly and they realize, wait a second, maybe my whole life I wanted to be a mom. Maybe this was a big goal to get pregnant, but now I'm realizing I don't know what contractions feel like. I don't know what the labor process is going to be. I don't know what my options and choices are. And it can really feel like you're looking into the abyss, that there aren't really good resources out there. And this knowledge isn't passed down kind of maternally in the way it used to be. And we're a generation of women right now who are used to being informed about everything. Like, we grew up with the internet. We make informed decisions about where to go out to dinner. Suddenly we get pregnant and it feels like that knowledge isn't there. So for me, I really try to fill that gap, to give that education ahead of time so that women understand what their options and choices are, what normal healthy labor looks like, and they can find their voice in the experience and their confidence in the experience as well. Because, I mean, as both of you know, birth is a core memory and it really needs to be treated with care before you're even in the birth room.
Yeah, well, I mean, it's the biggest transition that you're really ever going to go through.
100%.
Yeah. And that education piece is very empowering.
That's the word. It's absolutely empowering. I never want one of our clients to feel like something just happened to them in the birth room. I think it's really important for women to feel confident and empowered throughout the process and understanding physiologically what's going on in your body, what a normal labor pattern looks like, and then how to have good conversations with your doctors so you do feel like you have agency and empowerment in the experience.
Yeah, it's a process that can feel a little bit out of control sometimes. And I would imagine that the more educated you are, the more in control you can feel.
100%. And I always say, we talk a lot about birth plans, and that is something we work with our clients. But ultimately what I say is you can't exactly plan for birth. There's so many things outside of our control, what labor was going to feel like, how long your labor is going to be, what you're going to need medically or not need medically, but we can always prepare for birth, and preparation pays off no matter what. And I really emphasize that to families, that the education that you get ahead of time is going to play out no matter how your labor unfolds. And I think that's just so important. And we talk about like you can control the controllables, right? And you always have options and choices. Even if your goal was like that unmedicated birth and we end up in a cesarean birth scenario, for me, it's like what's important is that you feel like you have agency in this moment. So maybe it's a little thing like we can play your own music in the cesarean. We emphasize let's do skin to skin after the surgery instead of baby being taken away. So in all situations, the most important thing to me is that moms feel safe, that moms feel heard, they feel informed, and they feel connected to their body.
That's so important. And I've heard a lot of women talk about if they end up in a cesarean or they end up with a medication when they didn't want that they almost feel like they failed in a way. Are you seeing that a lot?
I do feel like a lot of women feel that way. And I really want to say that a big goal of ours is for women don't feel that way.
Yeah.
And I think that's why the education component is so important. Because it is really different. It's really different if things go a different direction than what you were hoping and you didn't understand your options and choices ahead of time. You didn't trust the doctor or midwife that was in the room with you. You didn't feel supported through what was going on. And as mental health professionals that can land as a trauma, right? And then you can have someone who is in a very similar in some ways situation where things are moving to a cesarean, getting medication that they weren't expecting ahead of time. But in this situation, they're having good conversations with their doctor. They've chosen a midwife or doctor who they trust. They have their partners educated and supported in the room as well. And they understand the why behind what's happening. And there can still be sadness in there, of course, but it doesn't feel like something's happening to them. It feels like they're an active participant in what's happening as well. So that's the little bit of control that we have, right? Is kind of protecting that in that way and making sure that mom and partner are active participants in what's happening, no matter how things are unfolding.
I know for somebody who is having a baby for the first time, some of these terms can feel a little overwhelming, like when you're putting your birth team together, right? Like,
right.
So I know for us, Cassie came to me and she was like, we need to get a doula. And I was like, what's a doula?
And then I was like, I don't really know, but I was told I need one.
I love that. My favorite is the arc of partners with doulas because they go from like, what the heck is a doula? My wife wants to hire you to like at the postpartum visit being like sometimes even more thankful than the moms that we were there. But doulas, there can be a little confusion around what our specific role is in the labor room. So I really want to emphasize that doulas are non-medical professionals. So we're different from midwives in that way. Midwives are similar to OBGYNs. They give you your prenatal care. They help give birth to your baby, really catch that baby in that way. As doulas, what we're doing is we're providing emotional support. So we connect with our clients throughout pregnancy, through text, through phone call, having conversations after OB or midwife appointments, being a resource for them. So providing that educational component of evidence-based information and really listening to them. I really see it as like we're unpacking women's like fears and hopes around birth, giving them space to voice that and helping them figure out what's going to help them feel safe and confident and empowered in that birth room. So we're sort of a guide along the way in that sense. And then we're in the labor room, of course, day of. We join women when they're in labor and we're with them till they have their babies in their arms and providing all different kinds of support, whether it's natural pain management, we're helping moms change positions, we're coaching them through breathing, really helping partners help moms, whether it's just bedside education and advocacy, really being a link between the medical staff and the partner and mom. So making sure that families understand the risk and benefits of anything being introduced medically. If there are some alternatives we can talk through and just making it feel good in there. Simple things like let's turn the bright lights off. Let's put some LED candles on. Let's put some music that actually settles your hormones. It feels good and then it regulates you as well, which helps your labor to continue. And those are kind of our big roles in the room day of that kind of separates us. I always say birth is more than a medical event, so we absolutely need that impeccable medical care, but we're holding the other part of it. We're holding that emotional care that needs to be there, the physical assistance as well, and being an advocate and an educator along the way.
That's so beautiful. And we can't overstate enough how impactful having a doula was for us with both of our births. And just to give people kind of an idea, we have the midwife who is giving the medical care. They're coming and they're checking the baby's heartbeat during labor, and they're making sure everything's okay. They're administering any medication that might be needed. They're maybe doing postpartum stitches, those types of things, where my doula the whole time was just holding my hand, giving me massages, telling me everything was going to be okay, playing with my hair, just doing things like that. Like, did not leave my side from the second I texted her, I think I'm in labor, until 2 hours after our baby was there. And I think that's the biggest difference, is that they're alongside with you. Like, they're your partner while medical professionals are coming in and out. It's funny, we watch our birth videos and, you know, there's all these people coming in and out of the room. And afterwards, I was like, I don't even remember.
Yeah.
There, at one point, there was maybe 5 people in the room with us, and I'm like, I didn't even know they were there until I was watching the video. But I knew my doula was there, and she was there the entire time. And even afterwards, I did have to get stitches, and the midwives are doing that. And the whole time, my doula is just laying next to me, holding my hand, telling me everything's going to be okay. And I'm like, you cannot overstate how impactful that was, to take a moment that felt a little chaotic. Like, I don't know what's going on. And she just was like, look at your baby. Look at your baby.
Yeah.
I'm going to hold you. Everything's going to be okay. And it was just so, so important to us. So we can't thank you enough for what you do. And we want people listening to really understand that we are huge, huge doula advocates.
Yes. I mean, that's such a beautiful story. Thank you for sharing it. And that is like what the work looks like. It's simpler than you think in some ways, and more complicated in other ways, but it's just showing up for a woman in labor. And it's being fully present with her and giving that undivided support. Like I said earlier, you know, support is the most underutilized resource. And it's just, whether it's simple things like I'm just making eye contact with a mom through labor and we're breathing through these contractions together, or rubbing a mom's back, or just telling her you're safe, you're strong enough, and we're going to work through this, or validating the emotions. And yeah, I love what you described as your experience, because that is so much of it. And that is also a magic piece of doula support, is it's that continuous support, is once we're with you, we're there throughout the entire labor, really by both your sides, supporting you in all those ways.
Yeah.
I want to talk about the husband's experience.
Yeah. Okay, great. Please do. I want to hear it
Because
too.
in these conversations, the mom gets all the attention.
exactly.
Which is
And now
fair.
him and our doula, they're best friends now.
Yeah. Well, for me, when she was like, I want to have a doula, I'm like, okay, I'm not really sure what that is, but whatever you need, because that's my role, is to support, and her role is to have the baby, right? And having a doula present at the birth, I think, even leading up to the process and afterwards, it's just like, my first time, I don't know what to do, and I think there was a great part of that, having that doula presence there. She's been through this before. Things are happening, and I don't know what, like, where are we in the process here? Like, when do we go to the hospital? Like, so I think that's a huge piece, is just empowering the supporter to help support better.
Absolutely. And the more I do this work, the more excited I get about that. And the more, because of course I got into this work for the moms, right? I feel really passionate about maternal health. But the longer you're in this work, you really realize it's a dance between both of you, and getting partners confident about the support that they can give. And it's a lot to ask of partners all of a sudden, and be like, know what to say, understand labor, know what questions to ask the doctors. So really my goal is to take that heavy lifting off. And I always say, like, the partner brings the love into the room and brings the sense of like safety, and knows mom more than we ever will as doulas. And that connection is invaluable. And then we bring our knowledge of birth into the room, and together we work to kind of carry mom through the experience.
I think it really stopped you from panicking. At one point, he
Yes.
was, during my first labor, was whispering to her and was like, is she okay? Is she going to be okay? And she's like, yes, she's totally fine. She's doing great. Everything's good. And it calmed him down, because I think if I sensed you panicking, I would have panicked.
Absolutely. That is being shared so much in that way. And a big part of the doula's role too is normalizing what's going on, because
Yes.
a lot of things that can happen in birth, if they happen in like regular life, would be a problem. Like, I don't know,
Yes.
sometimes in transition, moms will get the labor shakes, and they're shaking really, really fast. And it can look scary. And sometimes I will have partners look at me, eyes wide, Mary, what's happening? I'm like, no, this is a good sign. She's most likely going through transition. This is a way to support mom through this. We're going to really dig deep. We're going to breathe. We're going to give some nice firm pressure. And this is actually a good sign. It's hard work, but it's a good sign that progress is happening.
Yeah, you're totally right about that. And, that's very reassuring. I think the media has a big role in how birth is perceived.
Yes.
And I know for me, I always kind of thought that there was going to be this moment where, like, my water broke, the baby's coming, and I didn't even understand that, like, labor takes hours and hours and hours, and it doesn't happen like that.
And that my water didn't break either time.
Yeah.
Yes, exactly. This is a big one.
Yeah.
I mean, if you're writing a script, the easiest thing to put in there for a baby to show up is like water breaks, baby shows up, right? But the media has done us a big injustice. I mean, the media has done women a big injustice in many ways, but we see that in birth. And many people don't realize that you actually have to labor before you're going to push your baby out. So that's why that education is so important ahead of time, because there's honestly in many ways been a miseducation of birth in our culture. And what I like about what we offer at Philomena Birth is the partners come to all the classes too. So that's been really exciting because they get super confident. And now when women are, at home laboring before I join them, I have dads texting me and they're like, her contraction pattern still at a 711. She's curb walking, a little bit of show, this, that, and just using all the vocab and really confident in what's happening. And that just makes me so happy. It's like, okay, they're doing this together. They understand it. And they both feel giving birth to your child should be one of the best days of your life. And the more that we can bring the fear down, the more we can bring the adrenaline down, and the more that you can truly feel the love of that and the pure excitement, it's such a gift. It's such a gift. Yeah.
100%. Yeah, I remember I was like, gotta have the bag packed, right? And like when it happens, like I'll have X amount of time to get there or whatever, and it's just like having that doula there to say, oh, like this is what we're seeing, this is what to look out for, this is the time we go, right? And that was like invaluable.
Yeah.
Yeah.
Yeah. So you see a lot of women who maybe have had very traumatic first birth experiences, and then the second time around they think, let me get a doula, let me get some more support this time?
Absolutely. So we definitely, that is a percentage of our clientele. I would say our clientele, a large majority is first-time moms. And then I would say the second majority is repeat clients, and then second-time moms who've maybe had an experience that wasn't positive the first time. And absolutely and these moms who are second-time moms who maybe had medical interventions that they weren't expecting or something that even landed as a birth trauma. Or honestly, it's incredible how many who come to us use that and transform that. And these moms are getting educated. I mean, the most important thing you can do is choose the right provider. And I say that full stop. And that still shocks me as a doula. I primarily attend births in Monmouth County, but I've been to almost every hospital in New Jersey at this point. And even within one hospital, the care you get from each doctor and midwife is significantly different. Your options and choices are significantly different. If you don't feel heard in pregnancy by your doctor or midwife, you're really not going to feel heard in the labor room. And we live in an area where there are many choices. And that's the main thing I really advocate for families is change your doctor, change your midwife, find someone who you feel safe and informed with. And that really makes the biggest impact. And a lot of, I guess, clients who come with us who had maybe that first experience, that's a big thing we're working with. They're working to build a team that's more supportive of them, where they're feeling heard. We're talking about creating that birth plan and setting up, whether it's them working with other, having them really process that first birth too is really important with therapists and counselors in that way.
Yeah. What are some red flags people can look for in providers?
My first impulse is your intuition. And as a doula, that just plays, right? But I guess what I want to say is I think we all expect to feel not heard in the doctor's office. I think our bar is pretty low, and that as women, we can raise that bar. And there are doctors and providers who are at that higher bar that I think a lot of people, so some red flags I would say just off the cusp is you don't feel heard. You feel like you're being rushed out the door. You don't feel safe in your appointments. You ask a question and you feel like you're getting shut down, or you feel like you're getting brushed off. You deserve to be heard. You deserve to be listened to. You deserve to be working with someone who's excited about your pregnancy and like excited for this moment in your life. And what I really want to emphasize is those providers are out there. I think people think like all doctors are the same, all hospitals are the same, and kind of throw their hands up, but you really have to find someone. And I guess what I've learned with this work is some midwives or doctors are a good fit for one family and not a good fit for another family. But you can also just statistically speaking, look up the C-section rate at the hospital where you're giving birth, your provider's C-section rate, which could be very different from what the hospital's is, the induction rate. So those are kind of the biggest things. How do you feel when you're in the room with them? Are they listening? Are they hearing?
Yeah. Are those numbers that any doctor will have available?
Yeah, you can look it up. So I believe, I don't want to be like wrong here, but it's on Leapfrog online, but it's all public information. The stats of every hospital, the C-section rate, induction rate, all of that.
That's so empowering to be able to look that up.
It's education empowers, information empowers. And I know sometimes people think like it's very overwhelming to be pregnant and to have you're on the like edge of your life shifting in a way that you can't even imagine. That sometimes I think people want to like close their eyes and step away from that. And I absolutely understand that. But the truth is our medical system is something you have to navigate. And like I said, the care is so different from hospital to hospital, from provider to provider, that you have to be an active participant in your care. So yes, all that information is out there. And then also that's a good place where doulas come in too, is I often will, actually I had someone yesterday call me up and say just kind of what I said to you. I'm not feeling heard. I'm feeling brushed off. Are there doctors that you recommend in the area? And since we do go to all the hospitals and we have relationships with all the doctors, we can make, educated, informed suggestions to clients with that too.
Yeah, that has to be so helpful. And I love that you said not every doctor is going to be perfect for every family. It really is a match. It's kind of with therapy. There's a therapist that could be perfect for someone, but the next person's like, no, I don't think so. Like some people want a really hands-on doctor who's going to be on top of everything and ask you all these questions, where people like us, we really like the hands-off approach. I want to just go to my appointment. I want to feel very chill. I want to feel like you're excited for me to be there, and I want to kind of move on at my merry way. But I know not everybody likes that kind of care. So I think it's almost like dating in a way, finding who's going to be right for you and your mindset and your pregnancy. Some people have low-risk pregnancies. Some people have high-risk pregnancies and need someone who has, more experience in something else.
Absolutely. And I'm so happy you said that, because for me with doula support, it always comes back to these core values of women feeling safe, women feeling heard, and partners, all birthing people feeling heard, feeling safe, feeling connected to their body and their baby, and really feeling like they have agency and empowerment in the experience. And it's, for me as a doula, it's never about like an unmedicated birth versus unmedicated birth, or using pain management like an epidural, or having a water birth at home in your tub. That's never kind of the way I'm viewing birth. I'm viewing it just like you said, of everybody, how can this individual family's needs get met so that they feel safe, heard, and informed the entire time. Yeah.
Yeah. And I want to talk a little bit about a low risk birth versus a high risk birth. So obviously everyone wants to have a safe experience. People want to have their own birthing preferences, but there are women, of course, that have high risk births and that they need certain interventions that you kind of know that off the bat. How does that support look different from a doula perspective?
Yeah, that's a great question. And I would say that's another population that comes to us that either have like pre-existing health issues, so they've had to navigate the medical system before and realize the benefit of an advocate and an extra person in the room, or have high risk pregnancies and it's already feeling a little over medicalized and out of control, so they're trying to bring in someone else. Like I said earlier, for me, it's all about knowing your options and choices. So what can happen sometimes is you get a diagnosis in pregnancy and there's, a one size fits all approach is just with something simple, like let's say gestational diabetes, which is very basic, but just to kind of walk you through an example. Some providers will say, no matter what, if you have gestational diabetes, it doesn't matter if it's diet controlled or if it's insulin dependent or if baby's tracking big or small, or regardless, every single mom is getting induced at 40 weeks with our practice with gestational diabetes. But then you can have another practice, and this is what gets hard as a doula, because maybe I have another client who 2 weeks earlier had gestational diabetes that was diet controlled. Baby was measuring an average size, and that client was given, I don't want to say permission, but her providers felt comfortable with her going to the 41-week mark.
Wow.
So I think what's really important, and I think where women struggle, particularly when they start falling into this high risk categories, because there's a lot of things that can put you in there, is when they start feeling like they're not getting individualized care. They're getting kind of this one size fits all boxed approach. So with that, we really talk it through. And again, it's about finding a provider that's giving you the options and choices. And then if, many of our clients do need an induction, that is, we support a lot of moms through that. And it's always knowing, okay, these are your options for an induction. We don't have to rush it. This is how they titrate Pitocin. We can slow it down. You have options and choices around this. This is what they're looking for. So it's really bringing in that informed information so that you can visualize it and you have options and choices, and we're still holding that it's a birth, right? And we're showing up in that room. And just because you need to be induced doesn't mean you need to be laying flat in the bed. We're up, we're moving, we're changing positions. A lot of people don't realize that, even with an epidural in place. Like, let's say if I had one thing to tell a pregnant mom, it's change positions in labor. Movement is so important for all the reasons. But even with an epidural in place, you can't get out of the bed, but we are changing our mom's positions about every 45 minutes. And that helps you feel engaged with your birth. It keeps your pelvis open, keeps your baby down. So I guess what I also want to say is, like, we don't toss it all out the window. If things need to be more medicalized, we're still bringing in that like holistic approach. We're still making sure options and choices are there, and that you have the right care team around you for what's coming up medically as well.
If you had to put together like a dream team of providers, because there's some providers that women don't necessarily think about to engage with. So what would that dream team look like? What specialties?
Yeah, so we absolutely suggest that moms work with and families work with a whole group of providers. So we are often recommending families that a mom sees a pelvic floor therapist in pregnancy. A lot of people have heard of pelvic floor therapy postpartum, but really going to see a pelvic floor therapist while you're pregnant can help prevent tearing, can help shorten the length of the pushing stage, and honestly just bring that mind-body connection to the pelvic floor so that when it's time to push, where to kind of put that pressure into and your different options around pushing. Prenatal chiropractor, that is a huge one. So labor is all a dance between your baby and your pelvis. And the more that we can keep that pelvis nice and open ahead of time and really get that baby into an optimal position before we're even in labor, the more straightforward things can go. Never mind mitigating discomfort that can arise. An acupuncturist who specializes in working with women with fertility, there is a lot in our area, is great to just balance your hormones throughout pregnancy in the last month. And also, like, our families who maybe know I need to get induced for X, Y, and Z will often suggest going to an acupuncturist in the last month of pregnancy, where they can start past 37, 38 weeks, maybe working to do some natural induction methods in that way. Those would be the three biggest. Of course, I love everybody to stay like physically active. So whether that's, I love prenatal yoga, it connects the mind and the body, opens everything up again, or even weightlifting or anything like that, that's really going to help you feel strong and connected.
Yeah, I think some people have a perception that like the mom's pregnant and you need to take it easy, and that's actually not the case.
That is absolutely not the case. I mean, again, every pregnancy is different, and sometimes that is the case regardless, but we're strong. And what I say is, like, you'll hear a lot in the birth world, like birth works, right? As kind of this idea, it's natural, it works. What I always say is yes, and we live in this modern society. And what we have to counter from our modern lives is we're more sedentary than we ever were. And we're more in our kind of fight or flight high adrenaline state than we ever were. So what I really emphasize is we need to counter that sedentary with movement and with strength. So whether that's walking, prenatal yoga, lifting. And then similar with figuring out a way to regulate your nervous system. I would say this is one of the biggest ones. And I'm sure you guys in your profession are thinking about this all the time too. But birth is all a dance of the hormones. Oxytocin is the hormone that causes contractions. I love that it's also the love hormone. It's the love hormone that births our babies, not adrenaline, which is our, fear, fight, or flight. And really in labor, as doulas, what we're thinking a lot about is like, how can we bring the adrenaline down so that we can bring up the oxytocin, because they counter each other. But you want to think about this in pregnancy as well. How can I get myself out of this fight or flight, out of this high adrenaline, out of this really mental state, and regulate my nervous system? So whether that is yoga or meditation or listening to your music or going for your walk or whatever that is, you have to find that place inside you that connects you with yourself before you're even there. So those are kind of the two things. And yes, there used to be this idea of women being like pregnant and dainty, and no, we're strong. I want you to engage with your body and all of that. Yeah.
Yeah. We used to say when I was pregnant that it was almost like I was training for a marathon.
Yes.
And then like the race was labor. And so everything that I would do throughout my pregnancy, I'm like, I'm training. So whether it is going for a walk or, I would do a lot of hypnobirthing, like whatever I was doing would be that I am training for that big day, whatever that big day ends up looking like. But at least I know that I'm putting that effort in to make it go as well as it's going to go.
Yeah, I love that. And that's, I think, like I said, preparation always pays off regardless. And I think people can get hesitant with that because there are a lot of wild cards. And I've absolutely been in the room with women who are planning, this unmedicated water birth, and we end up in a quick C-section all of a sudden. And they've done all the things. They did all the hypnobirthing. They went to the pelvic floor therapist. They went to the chiropractor. But if they've, and it can land hard, it does, right? Of course. But I do find when I do those postpartum visits that they appreciate how in the moment they were able to engage with their body throughout pregnancy, right? That we can't just be focused on the goal of like necessarily holding too tightly onto like, it has to be this certain way. Whereas it's also the journey of your pregnancy, right? In your pregnancy, you got to go for these walks. You got this experience of doing your hypnobirthing. You built up all of that inside you and found your voice. That in and of itself has so much value. And that serves you after birth as well, regardless if things go in the perfect direction that you're hoping.
Yeah, it really helps you bond with your baby too.
Yes.
You're doing all these activities that make you focus on your pregnancy when, the world around you is still moving. But when you can bond with your baby, maybe there's a better acceptance. Like I would always say, the baby and God have their plan for how this labor is going to go, and you just have to be there for it, right? Because the baby ultimately will decide how they want to be birthed, and unfortunately, we can't convince them otherwise sometimes. But if you do have that bonding time with them, and you can just say, like, I trust you, and whatever you need, I'm going to do that for you. That might help a little bit in those situations.
Absolutely. And that's beautiful. And we talk a lot about connecting with your baby, your body, and your breath, and linking all those in pregnancy. And it is so much because our world is so busy. You can go through your whole day, maybe even just not even have a moment to check in with your pregnancy. That really carving out this time to honor it makes a huge difference. And that's another thing about our classes that I like is it's just like 2 hours where you and your partner have to like come, stop thinking about everything else, phones away, and we're just going to focus on being pregnant and getting excited about and informed about that.
I think birth is all looked at a lot like it's a physical thing. And I want to talk a little bit more about the mental components to it. So in the pre-birth period, what are some things you're seeing with the women that you work with, concerns, anxieties that they're having, and how does that play a role into the birth itself?
Absolutely. I mean, the first thing I want to say is It's huge, right? And it's a really tender, delicate time in life where your life is transitioning really fast all of a sudden, and you're kind of in a liminal space and an in-between time where you're not quite, you don't have the baby in your arms yet, but you're building this baby and this huge birth is going to happen. And then after that, you're going to have to take care of a child. That a lot of emotions do come up in pregnancy, and totally expected, whether it's anxiety around the birth, whether it's anxiety around becoming a parent, the relationship between you and your husband, how that's going to change, even sometimes about your extended network. My mother-in-law, how is she going to step in? My own parents, it brings up stuff from your childhood. What was your relationship getting raised? So I guess what I want to say is it's normal for all of this to come up, and it's all about how you can manage it, right? Like we talked about creating a team of people around you, and we are always recommending moms see therapists that specifically work with pregnant or new moms, because it is such a unique time that needs that certain level of care. And we want you to be feeling safe in your body and excited about your pregnancy. And some women can have feelings of even your body's changing so much. So that comes up with a lot of women. I don't even feel comfortable in my body anymore. It doesn't look the way it used to look. So as doulas, we're really listening, kind of getting a pulse of, is this something that needs extra help and extra support? Is this something we can just talk through ourselves and give resources of books in that way? But it is a huge emotional experience as well, of course.
Yeah, 100%. Are there some books that you recommend to women read before labor, or?
Yeah, so specifically so there's a good book called The Fourth Trimester, which is wonderful, that I would recommend around like kind of mental health. As far as like labor and birth, I really like Expecting Better, which just goes into kind of the statistics around what goes on medically in our world and what's happening with moms postpartum as well, and what support systems are there.
Yeah. How do you help women protect their mental space and their peace when they do have all these things hitting them from all over the place? Like maybe they're getting stories all the time. I had this traumatic birth, or this happened to me. How do you protect yourself from that?
We talk a lot about this. And like I was saying, even from like extended family. So we talk about, you want to really invite people into your space who are going to fill your cup up, who are going to help you. You can't have people there who you just feel obligated to be either in your home postpartum helping you, or even in the birth room. Some people will say like, it's going to be you, my partner, and my mother-in-law is going to be there. I don't really want her to be there, but she really wants to. And yeah, you're already making that face. No,
don't do it.
Don't do it. I mean, particularly as women, we are so used to accommodating other people's needs.
Yes.
And it's really important during this moment that we're not doing that we are learning. And this is a big part of what I try to do. Honestly, figuring out how to get women to use their own voice. And the stakes are higher when you're pregnant, right? You're becoming a mom. You know that the outcomes can change depending on whether you advocate for yourself or not. So really finding your voice in that space and figuring out how to voice your needs can be a skill that some women don't have, that some people don't have, right?
And that's where the partner can step in too.
Absolutely.
That's definitely a role that I played during Cassie's pregnancy.
Yes. We were very strict about not having anyone in the room. And it's nothing personal. We don't even have negative relationships with our family.
Right.
It was just, I knew that I needed to be in my primal birthing headspace, and I didn't want anyone there. And I didn't want the constant, is she in labor? What's going on? Was the baby born yet? So I even said, please don't even text anyone. Don't even tell anyone I'm in labor. Let me just be peaceful. And thankfully, both times I went into labor in the middle of the night.
Okay.
So that helped a lot.
I think a lot of people feel a sense of obligation because
Yes.
it's like it's a big life event, and obviously grandparents want to be involved and your parents want to see it and everything. But I think in this scenario, both of us came to an agreement that like it's okay to just prioritize ourselves right now and our family.
That's it. I love how you said that. You prioritize yourself and your family, and that's what you have to do. And especially with like the phones and social media and group chats, it's like like the paparazzi, right? Yes. And we talk about that. We're like, and you have to make a plan ahead of time so you're not just in it and you both don't just assume, oh, of course I'm going to text my mom after the baby's born, but you haven't talked about that ahead of time. That can be a big fight. So we really make sure we have that conversation. What is the conversation's going to be like with people through text while you're in labor? Are you going to text a picture out? What's that going to look like? And we talk a lot about the first 3 weeks, the first 6 weeks postpartum, who you're inviting into that space to help take care of you, to help take care of baby. And yeah, again, the same idea that they're able to build you up and not drain you. It's... it's just underestimated the amount that women are going through pregnancy, through birth, through postpartum. The birth of the baby is the most exciting part, but it's not the end. Your body has 6 more weeks, 3 more months. I would argue a whole year of big changes that need to happen for your health. And you should be the center. And everyone should be taking care of you. Oh, yeah.
Yeah, 100%. And you referenced like a marathon, and the birth is the birth is not the finish line.
Yeah, I know.
And like,
yeah, it's actually more the starting point.
It's like, you're right.
I know.
So I think a lot of people are, they don't know what to expect postpartum.
Yeah.
And I think that's a big source of anxiety.
Mm-hmm. That is.
Yeah,
I think, what's hard is we live in a world that expects women to just bounce right back, get your body back, jump right into work. I mean, just as a country, we don't have national maternity leave, which is ridiculous. So because of that, we don't have a social norm of women needing to heal and bond with both the baby and their partner. And for this being really a pivotal moment in the family's life. And with mental health, I think this is just such a tender moment that can set the direction for the rest of your journey as parents, as a couple, honestly, in many ways, and for your child as well. I mean, they're little babies, but they're soaking everything up. So I just think it's really important for people to realize that the birth of the baby is the most exciting part, but mom's body started the process 9 months ago, and it doesn't end with the birth of the baby. It continues for 6 weeks, for 3 months, and like I said, for a long time after.
Right. And you mentioned the bonding. I think a lot of people expect this kind of golden hour after their baby is born where they're put on your chest and you just feel this love and excitement. And sometimes people experience that, but sometimes they don't experience that right away. Can you speak a little to that? Because I know that's a big disappointment for women when they don't feel that bond right away.
Absolutely. The first thing I want to say is that's totally normal. That especially depending on how your birth went, sometimes women have been laboring for 20 plus hours, haven't slept for 2 nights. Things have felt out of control for maybe a long time. And then suddenly their baby's born. And the first thought is really, I'm glad that's over, or I'm exhausted or I'm hungry. And that's absolutely normal in that moment. And honestly expected if you look at the situation and think about it, right? We absolutely want moms to bond with their babies, and keeping baby on mom's chest regardless is the best recommendation, is to put baby immediately on mom's chest. We call that skin to skin contact, and leave baby there for at least 1 to 2 hours, if not longer than that. And I would say if moms, and I have had moms struggle in this moment, are struggling in this moment, really as much skin to skin in those first few weeks or days if you're having trouble bonding with your baby. And even if immediately after birth, it is just a sense of overwhelm, I also want to give the permission of your partner can do skin to skin. And I've absolutely had moms look at me and be like, I just need my partner to hold my baby for a moment. I bring baby over to partner. They take their shirt off. They do skin to skin. And it's like, mom's like, I need to brush my teeth. I need to wipe my face down. I need to just take a beat. And also there's a lot happening immediately after birth. So I've had that. And then mom kind of comes back into herself. We bring baby back over, and you're allowed to have that moment. If you continue to struggle with that connection with your baby, that's where I would get more concerned about than right at that first moment, right? Mm-hmm. We absolutely want that bond to be there. I always recommend lots of skin to skin contact. You always want to be checking in. Can you take care of yourself? Are you taking care of your baby? Are you staying at a low or staying at like a too high? and then sending resources for either having them go back to their OB or midwife, or, recommending them over to see a therapist in that way.
Yeah.
Yeah. If you could paint a visual of what an ideal like postpartum period would look like, what things are being put in place ahead of time to maximize everybody's well-being.
So I think the biggest thing is that you're really having a good, thorough conversation with your partner about it, because sometimes, especially with my work, we're talking so much about birth that all of a sudden we can forget about the postpartum period. So one thing which I think we've touched on already is a good sense of a postpartum plan and like boundaries around who's going to come into the home and what that's going to look like. So I always say you want to have at least 2 people who you trust, who can come into your space and help you, and who know that they're your 2 people. And sometimes you might be surprised. It's like not your mom and it's not your sister, but it's your friend, So really try to discuss that as a team and have a clear sense of what everybody's responsibilities is going to be. A lot of people, they really want to help. They don't know what to do. So when someone comes into the home, giving them a clear task, like, hey, we're really going to need you to clean out the dishes, grab some groceries on your way. This is the list, and like fold some laundry. And that can be hard, but it's a lot to take care of a baby, to heal after birth, that you need a village, and we don't have that in the way that we used to.
Yeah, if you're visiting a mom postpartum or a family, you're not there for visiting.
No,
like, please just do some dishes or
Yeah. Can you give us the ideal visitor? Like if there was just like, I don't know, like light shining behind them and they were the perfect postpartum visitor.
I love this. Okay,
what do
great.
they look like? What are they doing?
They're lovely. They actually, when you said that, I thought about some of our postpartum doulas, because I didn't have a postpartum doula when I had my babies. I did have a birth doula. And when I think back, I'm like, oh, I wish I had a postpartum doula. So what I would say is this, is someone is coming into the home, maybe they're bringing a hot meal with them, maybe something homemade, something that the family knows they're going to love. I don't know, I'm seeing a lasagna. And they come in during hours that are good for the family, with a clear time that the family knows they're coming. So let's say 10 a.m. and they say, I'm going to be here till 2, a clear exit time too. So like there's something held in that way. They come in with something for the family to eat, and then really sit down on the couch and meet mom where she is. You don't want to come in with an agenda, and that's with birth as well. You need to see what's happening to see what needs to get met. So whether that's the support person comes in and just sees mom and she's sitting there and she's upset she can't get baby to latch, and it's meeting her there and helping with breastfeeding, or whether it's looking around the house and saying, yes, we need to organize things. It seems like the dishes have been piling up for a few days now. So I would say coming in with like an open mind and an open heart, and with hands that are expected to be busy. So really, I like to think about something that's going to nourish mom, something that's going to help with some household chores around the house, and that's something that's going to, as a postpartum doula, like educate in some way or help in some way. So whether that's like, let's figure out this swaddle that you have here, or let's work through the pump, and let's just really show up in a big way without an agenda. That's so much of it. Support, whether it's birth, whether it's postpartum, is a skill, and it's a skill that's getting lost in our world. We're all in our own lives. We're all very busy, that it's hard for people to know how to just show up for another person and figure out how to meet their needs. Yeah.
I love that you're saying show up and see how people are feeling, because it is the Wild West of postpartum.
It's the Wild West.
You could show up one day and we're all happy and laughing, and there's something on the TV and everything's going great. Or the next day you're coming and mom's hysterically crying, he's pacing with the baby, and things are a mess, and who knows what's going on. So I love that you're saying just kind of show up and assess first, because sometimes we want you to sit and just chat with us and hang out and help us, be in that good mood. And then other times we're in survival mode and like, we need a lot of things.
100%. And that's a big change from your life prior, right?
Mm-hmm.
And like we live in a society, in a world where we're very scheduled. We're used to our calendars. We're used to things making kind of like a logical sense. And then suddenly you're in baby world, and like nights aren't even nights anymore. Your time is not your own, and everything radically changes. So to just have someone come into that space and be like, this is normal. Every day is going to feel really different for a while, is huge as well, because that space isn't it's so radically different from the lives that
Yes.
we lived before.
You can't. It's hard to conceptualize.
It's hard to
how
conceptualize.
different it is until it actually happens, and there's a very real grieving process that occurs postpartum.
Yes.
Can we talk a little bit about that?
Absolutely. There is a very real grieving process. And I think part of that is it's kind of what I said before. I've thought a lot about this. I'm just going to talk about my mom for a moment. Is my mom grew up in Ireland. She had me when she was 47. So she's like from a different generation. And she grew up in very rural Ireland. And she started working in a shoe factory when she was like 12. Her time was never hers. She started working when she was 12, worked her whole life, always sent money back home, always spent money to take care of us. That I think sometimes about us as a generation of women, where before we have children, a lot of women, not everyone, but we have an autonomy of our time in a different way that honestly people previously didn't have. Free time is kind of a new thing and really setting ourselves on our direction. So for me, what I feel like I see and honestly experienced myself becoming a mom is this grieving process of your time is not your own anymore. And your mind is not your own anymore. And really figuring out how to navigate that is a huge shift. And then just the huge responsibility of taking care of your baby as well, right? And then the hormonal shifts that are going on with mom. And there's absolutely a world where I like to emphasize that it's a hard moment in life. It's full of joy. It's full of love. But it's same with labor. Like, I'm not the kind of doula who's like, you're just going to hum your baby out. I really am of the mindset that it's hard work, but we can do hard things. And similar with postpartum, actually, is it's hard work, but we can meet that. Of course, we're always like paying attention and looking for signs for things like postpartum anxiety or postpartum depression. And that's really signs of that are, mom not being able to take care of herself, not being able to take care of baby, that we're having more kind of negative moments instead of those positive moments. Honestly, a clear sign that we see is mom isn't eating, mom isn't showering. Those are really big red flags in my mind. And it often, I feel like we see more of the anxiety than really the depression, that it's more that mom's mind won't shut off, that the anxious thoughts are there, that they're not coming down, that they don't want anyone else to take care of baby. And that's more when we really need to lean on professionals like yourselves and get moms the support that they need to get through that. But outside of that, there is a hard that's just there that is just, I think, part of transition in life, right? And you're going through a major transition and figuring out who you are as a new person for both of you and as a couple.
Yeah, it's so great that you have a postpartum doula, that they're there with you in those moments and that they can see those red flags, because I always find it really interesting how there's not a lot of screenings for new moms, and the ones that they give you are always the same. You go to the pediatrician,
It's
they give you the
infuriating.
same exact checklist to go through, or scale, and you know what to say, right? I'm having them check on my baby. I'm sorry. And are you more anxious than normal? Nope, putting a 0 for that.
It's infuriating. It's infuriating.
Yeah.
And the lack of support. You know what? I think the Surgeon General put out a statement saying that loneliness is the biggest epidemic that's going on right now, and is one of the biggest health concerns, honestly, out of everything. That's what the Surgeon General puts his statement out, right? And it's devastating because, particularly as new moms, this loneliness that can come and the isolation that happens where we don't have any support in that way, whether it's through even a pediatrician reaching out or your OBs really engaging with you, asking you questions around how you're feeling, normalizing your experience or figuring out what care you need. It's missing. And as new parents, it can feel very isolating. And we don't have larger systems of community support typically in place. And I think that is causing a lot of damage. I really do. And that loneliness that can happen in the postpartum period is serious. And that it's really, I wish that there were more immediately available resources that were more reaching out to moms than that moms having to go find in and of themselves.
Right.
And it is, in our country, we don't have eyes on moms postpartum. It's actually kind of terrifying, to be honest. You have your baby, and for many OB or even midwife practices, they don't see you for 6 weeks. And that's a critical time.
It's a lifetime.
It's a lifetime.
Yes.
It's a lifetime. And there's important physical changes that have to happen in your body, the emotional ups and downs. And a lot of women are like, I just had a baby. Of course I have a headache. I just have a baby. Of course I don't feel good. And are kind of gaslighting themselves in some ways, where if we had a trained professional having eyes on mom, we would really be avoiding things cascading into larger problems. And it's infuriating, honestly.
Yeah. And I think that education piece of, okay, if you do have these symptoms, here's what we're going to do. We're going to get you to a talk therapist. We're going to work through some of those. We're going to get you postpartum support so you can get a little bit of sleep. I think a lot of it is that fear, right? Like you're just in this, maybe a pediatrician office, maybe your OB's office, and you're filling out a survey and you're thinking, what are they going to do to me if I say yes to these questions?
100%.
That's terrifying.
It's terrifying. And a lot of times it isn't about giving resources and solving problems, unfortunately. And I wish that was more what the conversation centered around. I will say that's the Edinburgh scale that they give you to screen for postpartum depression, anxiety. And it can be helpful. I mean, I do emphasize that everyone try to be honest on that. It's hard. Absolutely. You feel like they're going to judge you. People get nervous. Something's going to happen to their baby. People are going to think they're not an apt mom in that way. But ultimately, they're trying to diagnose and get you some care in that way.
Yeah, really, a referral would just happen, right?
Yeah.
You're not going to get institutionalized.
No, you're not getting institutionalized. Nothing's a referral would just happen. Honestly, they would refer you to your OB, who would either send you to talk therapist or prescribe some medication. Yeah,
well,
like an antidepressant.
My pediatrician did call me out on not filling it out correctly because one time I just put like 0 for everything, and she was like, you just had a baby and it's a little hard for me to believe that you don't have any of these symptoms. And I was like, I'm just doing really well. And she was like, you're a therapist. Like, you know how to fill this out. I was so embarrassed.
She called you out big time.
So I was just like, no, I'm totally fine. And I was like, let's change the subject now, because I'm thinking, I would rather just go find my own resources than depend on the situation. But, because there is that feeling of like, do they really care what you're going through, or do they just have to do this because they have to do this? And maybe that's on me feeling that way, but I'm sure a lot of moms do.
A lot of moms feel that way, and unfortunately, our system is a business. It is, and this is kind of the water that we tread. I think more and more, I do think things are changing, and more OBs, more practices are starting to realize that there's more resources out there. You'd be surprised how many doctors have been referring clients out to us for even birth doula support and postpartum. So I do think the tides are changing in that way. And like I said, unfortunately, you have to find your own village. I wish the village came to you. But what I want to say is that it's out there. And that if you're struggling, if you feel isolated, if you feel overwhelmed, if you feel like just honestly lonely in this experience of motherhood, there is community, there is resources. And once you start looking, you'd be shocked what you would find. Here in Monmouth County, there is an amazing network of lactation consultant, mom classes, therapists that work with new moms. Just, it's incredible, but you don't know it's there till you know it's there, if that makes sense. Yeah.
That's where having an advocate like a doula is so helpful.
Right. And aside from just the care of just like, you're connected, right? Like you're a professional, who to go to, who to not go to. I think that's super important in building a team.
Yeah.
Absolutely. Yeah, absolutely.
And it's worth doing the work, because it is a lot of work. It's hard to reach out to, it's the last thing you want to do sometimes, but I think putting that work up front is going to really improve the experience.
It does. And I'm glad you mentioned that, because getting all these resources, ultimately what you want to do is set this up before baby's here, right? So that when baby's here, you already have a postpartum plan. You already have postpartum support set up, where your lactation consultant is, the mom groups are, the therapist. And we really do that through our practice, but everyone can do that research and find that for themselves.
Yeah, I want to talk a little bit about the relationship between mom and dad, right? Because that's the bedrock of the family. So, and it changes a lot after a birth.
Yeah.
What are you seeing as the biggest challenges postpartum when you're in these environments?
I think what's hard is I've thought about this too a lot. It's like often, not all families, but often like a couple before they have a baby feel like they have a good sense of what 50-50 looks like, right? That like often many women grow up in a world where we've been like splitting the checks with our boyfriends, splitting the rents before we have our mortgage, everything, and both going off to work every day. Everything is kind of a clear cut, even split in that way that makes sense in our linear minds. And suddenly you throw a baby in there and it can feel wild to navigate. Wait, I'm doing more because I'm breastfeeding. No, I'm doing more because I'm doing X, Y, and Z. And it suddenly, I think that becomes the hardest thing of like, how does this balance out together? And how are we working together towards the same common goal, offering two different things? And I think figuring that out is definitely something a lot of families try to struggle with in the first few weeks. And really, I think one of the best things that's happened recently is more partners or fathers are getting paternity leave from work. And I think this has really helped because I feel one problem that would really come up is mom would be home with the baby. Maybe dad would get a week or 2 weeks, but then he would leave. And now mom and dad are in two completely different worlds. And that creates a tension of, okay, dad gets to go to work and be in his own brain and like talk to adults and have his cup of coffee, and then having to come back and meet mom in that newborn place is a struggle. And even so, the fact that now some families who are lucky enough to get paternity leave, the whole family as a unit is kind of able to figure out the rhythm, I think I've seen be a huge gift to families.
So if a father has access to
access to paternity
leave, you would recommend because because a lot of people don't realize that the state of New Jersey offers it. It's paid, and I guess it depends on who your employer is, but you can get paid for 12 weeks from the state for paternity leave.
Take it.
Take it. And I do suggest, it is always different with childcare and families, but take a bulk of it up front. Some people do say like, okay, mom's going to take it on the front half. Right. I'm going to take it on the second half. But there is a lot of value to at least having, if you can, and trust me, I know that it is a privilege to have paternity leave. But if you can spend that month together, at least as a family, I think it helps mitigate some of these problems that can come up in a relationship. So just being in two different worlds, you're together, you're figuring out, and you're both understanding how hard it is.
Going into it, do you suggest anything for couples to help prepare them for that postpartum period of, I don't know, exercises they can do or conversation
Couples
topics
therapy.
They can have?
Yeah, I'm of the mindset with everything, more preparation always pays off. I don't know, bring consciousness to anything that's gonna happen. So it's like, okay, this shift is gonna happen. How can we approach this? You'd be surprised how many people just never have a conversation about postpartum and what the expectations are and like what the core family values are, and also making sure you always have time every day where it's just the two of you focusing on the two of you. So whether it's like baby takes a nap every day at 4:00 and suddenly you move your dinner to 4:00 every day, and instead of doing the laundry, doing the dishes, doing all this stuff, you're just eating dinner together or watching your show or talking to each other. But mapping it out really intentionally before you're just in the deep water, I think is really important.
Yeah, that's major. And I love talking about going through it together. Like it might still be really chaotic and messy and all the things, but you're doing it together. I think if you can put this kind of bubble around your postpartum experience, that's the best thing that you can do. We always try to prioritize at least those first 40 days. If you can just, be there together, go through it, and just have that support, I think it's really valuable.
It's so valuable. And for all three of you, for the baby as well, I think they say, I read something too about how paternity leave is like transforming fatherhood, right? And I could almost cry. It's so sweet. The amount of time that these babies are getting with their fathers is so different. I know it sounds silly, but I always say babies have no advent, no voice, right? And we're always talking about these things through like the mom's lens or even the dad's lens, which is so important. But also these babies, of course, any loving caregiver is going to provide that love and support for your baby. But the parents in that moment are truly critical. And to be able to spend that time with your child and really go through it together, it's wild. And for you all to be in the Wild West together and kind of transform in that month, that first month of parenthood is transformational, right? You get home, you look at your baby, you think, I don't really feel confident changing even one diaper right now. And then by the end of the week, you've changed 30 and you're like, I'm doing this one-handed, right? So in 1 week, it's transformational. By week 2, you're like, okay, I finally understand how to feed baby. And like, we have our rhythm a little bit. So it's a really condensed, short amount of time where a lot happens. And if we can do that with care, if we can do that with support, if you can do it as a loving team together, it's going to set you up for success in parenthood. It just is.
Yeah, and it is true. The learning curve is steep, but it happens quickly because it has to.
Yes.
Right? And having that perspective of this isn't forever, right? It's so important.
Yeah.
So important. I think that's honestly the most important, because it can feel just overwhelming when you have those sleepless nights and you think, okay, is this our new lives now? Are we going to be up every hour for the rest of our lives? And babies have a huge transformation in the first year of life. Your baby can just about hold their head up and latch onto the breast. And then by year 1, some of them are walking. So that's a lot of change that happens, and change that happens in your lives because of it. So everything is temporary with the kids and with, Yeah,
it's beautiful thinking about the baby's perspective, like you mentioned before. And I remember reading something before we had our second baby that just explained what the baby was going through. Like they're crying in the middle of the night because they wake up and they feel hungry, which the whole time in your belly, they never felt hungry. They never felt cold. And now they wake up and they're cold and they're hungry. The only thing that they want is their mom. So they're calling out for you. And I could cry just talking about it, but just keeping that perspective. Not that there weren't times that I was annoyed. Why are you waking up? I'm exhausted. But just trying to go back to that.
It helps build empathy.
Yeah.
It
Like
helps build
think about
empathy.
their experience and what they're going through, and that you are their source of comfort. And I think that can help when it feels like this will be forever, because it isn't forever.
Absolutely. And I always like to emphasize that human babies are some of the most vulnerable of any mammal baby. If you think of a horse when it's first born, it can walk pretty quickly. It can defend itself. Its digestive system can even process and break down stuff like grass. Of course, mom's milk is the best. But with our newborns, they can't defend themselves at all. They can't get from point A to point B. They are 100% dependent on their parents. They say that kind of all babies are premature because if babies, our heads have to be small to fit through the pelvis. And if we were any more developed, we wouldn't fit through the pelvis. So really that last trimester, the 3 months post-birth, there's a lot of things developmentally happening outside the womb, that it's really important that these babies' nervous systems are regulated, that they are getting that skin to skin, and
And things that follow for the rest of their life.
for the rest of their lives. I mean, I'm thinking about this more and more, and I'm sure with you guys, with your practice, you're thinking about that too.
So I just think having those resources in place and knowing, okay, this is what the journey is going to look like, is just so, so valuable when you are dealing with such big, precious moments, but also really little, maybe feeling insignificant moments too, of I'm just changing a diaper again. But when you have that zoomed out lens of like, no, this is what you're doing. You're caring for a human. You're developing your family, like all of these things. You're becoming a parent. There's a reason you're grieving, because you're leaving your old life behind and you're getting this new life. And that's a beautiful thing, even though it's a hard thing. So I think it could feel really insignificant sometimes, but none of it is.
No, I mean, that's the whole journey of parenthood in such a big way. It's like the day to day, but it's making a major impact how you treat your child, the care that you give, how your family system is on how your child thrives in this world. Yeah, it's just so important that these moments are that we give them the container that they deserve. I think you're not meant to do it alone. We're not meant to be isolated. And we've created a society, unfortunately, that leans towards isolation, that leans towards us just internally saying to ourselves, I should be able to do this on my own. And that's such a lie.
That's
it's such
the
a
biggest
lie.
thing.
It's such
Yes.
a lie. That's such a lie through birth. It's such a lie through postpartum. It's such a lie through all of it. We are a species that's meant to connect and lean onto each other for strength. And I just want to scream that from the rooftops is it's a beautiful thing that we need each other. And it's really too bad that we don't have a society that leans more into that.
Yeah. Yeah. I think the parents are so vulnerable during that time that they do need to be taken care of too. And I'm so happy you said that, for women to realize that you're not expected to know how to do everything and you are expected to lean on people. I remember with our first, crying to Brandon, being like, I need someone here every day to help us. Like, I can't even be a mom. I can't even take care of my own baby, because why should I need this help? I shouldn't need my mom to come over and do my dishes or my house falls apart. Like, feeling really like I couldn't do this. And I think, my mom made a comment to me one day. She's like, because parenting is the one thing you can't just do perfectly. You can't just plan it and everything is done and you're good to go. And the harder you work, the better it is. She's like, it's just hard. And that still sticks with me to this day, because I was like, wow, I really thought we were just going to be able to just do it so well. And I think we did, but it's really hard. Unlike something else where you could just plan, okay, with work, I'm going to start here and then I'm going to go here with my career and then I'm going to do this. I'm going to graduate. You can have like these really linear ideas of what you're going to do. And parenthood is not like that at all.
It's not like that at all. I love that. That
was
was so well said. I think you said that perfectly.
Yeah, it's an amazing but very humbling experience.
very humbling.
It's
There's
amazing
nothing
and
like it.
humbling.
Yeah.
Absolutely. And again, it's just as parents, we're showing up as support too. And it's that similar thing of you show up every day and kind of see how the day is going to go and how things and what your child needs.
Being
And
flexible, lowering your expectations a little bit.
And I love how cyclical it is, because we've never depended on our parents as much as we do now than probably when we were very little.
yes.
Now we're back in this stage where we're like, we need you guys. And like, thank God we have that help and support. And I know not everyone does. And that's where I think having someone like a doula, you might not have that family support, but you can find support, like you were saying. And it's so valuable to know that it's out there.
Yeah, absolutely. And like I said earlier, you're not meant to do it alone. That it is bigger than you. You're raising a child.
Yeah.
Like, it's supposed to be a community, and it's out there. And similar, like what I was saying earlier, like, you have to go find it. And I promise your village is there. Your community is out there. You might have to push yourself a little bit, but it really changes your experience.
So for somebody who is looking to start building their team and, finding their village, how can they find you?
Okay, great. Yeah. So my business is Philomena Birth. Our website is philomenabirth.com. And then I'm on Instagram, just Philomena Birth. And check out our website. There's a lot of good information on there. We primarily offer birth doula support and postpartum doula support and childbirth education. So yeah, check us out there. There's a button to schedule a consultation. We can jump on a Zoom call, talk about things. We have a collective of doulas who work with us who absolutely love everyone. We have one doula who's an herbalist, one doula who's a prenatal yoga teacher. So a great team. We're all really passionate about what we do. I love working in the maternal health field. Support and education change outcomes. That's my mantra. I see it all the time. Hire doula, get educated.
Hire doula. Yeah.
Yes, hire doula.
Hire doula.
You can leave with
You will
anything. It's
you will
hire
not regret
doula.
that
Yes.
decision.
Yes. Well, thank you so much for coming here today. This was such
Thanks
an
for
amazing
asking me. It was
conversation.
such a pleasure. Such a pleasure to meet both of you.